Also, Hep B, circling back just really quick, I think a good point one of the nurse practitioners made today was when we say bodily fluids and blood, sometimes that can be misleading, but saliva
Yeah, for
counts.
sure.
So, like, you think about daycare and a bite, and how often do we see that all the time? It's not just adult activities or, drug use, but saliva. Like, that's all the time with little kids.
But not only I mean, often we end up having to do all these tests for that, like children that get a significant bite from another child because you don't know. Again, if someone says, "How do you know that that kid doesn't have it?" You don't, because most kids wouldn't necessarily have symptoms and could have it. Yeah.
Okay, so Hep A, don't we mostly just get it from food and travel? Do we still need it if we're not traveling anytime soon? Why 12 months? Aren't most cases mild? Those are the most common questions I feel like I hear.
Yeah. So again, I think part of it's what's instructive is looking at sort of how the recommendations evolved. There were certain states for years. So when I started,
So many years
yeah,
ago.
there were just certain states that had higher rates of hepatitis A infection, and so those states had a universal recommendation.